These three solutions are commonly used in the emergency room to treat the dehydrated patient. Normal saline or lactated ringers are often used to restore a deficit in both extracellular fluid volume and electrolytes. In other words, these two solutions are used during isotonic dehydration due to blood loss, vomiting, or diarrhea. 5% dextrose may be the solution of choice when fluids have been lost in excess of electrolytes. In other words, hypertonic dehydration, which may be due to excess sweating, osmotic diuresis, or hyperventilation. These three solutions all have one thing in common. They are all isotonic to the body fluids. The first objective of this videotape is to review and demonstrate the permeability of a cell membrane to various solute particles. Slide number 1, the permeability is directly proportional to the partition coefficient, or the permeability is directly proportional to the lipid solubility. The permeability of a solute particle through a semi-permeable membrane is directly proportional to the partition coefficient. For example, ether diffuses through a cell membrane much faster than ethanol. In slide number 2, the permeability of a solute particle through a semi-permeable membrane is indirectly proportional to its molecular weight, as shown by the equation. The next slide shows anions diffuse through the cell membrane at a greater rate than cations. Monovalent ions diffuse through at a greater rate than divalent ions, which diffuse through at a greater rate than trivalent. In other words, the permeability of an ion is inversely proportional to its charge. The second objective of this tape is to identify the various properties of osmosis which cause water to diffuse across a semi-permeable membrane. These properties include osmotic pressure, effective osmotic particle, and non-effective osmotic solute particles. A simple laboratory experiment in osmosis and osmotic pressure will now be demonstrated. Blood is added to distilled water Then it will be added to the next solution, which is 0.1% sodium chloride. Blood will next be added to 0.85% sodium chloride. Then to 1.5% sodium chloride. And then to 5% dextrose. All of these tubes will be vortexed, and then they will be centrifuged. Notice that hemolysis has occurred in the tubes containing water and 10% sodium chloride. Hemolysis has not occurred in the next three tubes. Centrifugation has packed the intact red blood cells in the base of the tubes. A microscopic slide shows the RBCs in a 10% sodium chloride. Notice that there are only a few red blood cells in this slide. They are enlarged and asymmetrical. This is a hypertonic solution. A microscopic slide of the red blood cells in 0.85% sodium chloride is seen in the next slide. Notice that these red blood cells are biconcave disc. They appear rather symmetrical, which is normal for erythrocytes in isotonic saline. The next slide shows crenated red blood cells. These are red blood cells placed in 1.5% sodium chloride. Notice the decrease in volume and the appearance of the crenated cells. This is a hypertonic solution. 5% dextrose is an isotonic solution. Glucose is an effective osmotic solute particle, and diffusion of water between solution and cells is at equilibrium. This is a diagram summarizing the results. In the upper left-hand corner, a normal red blood cell is placed in isotonic saline. 1.5% sodium chloride is added and it becomes crenated because water diffuses out of the cell. When red blood cells are placed into a hypotonic solution, water enters the cell at a greater rate than it is leaving in response to osmotic pressure. The cell will become swollen and eventually will hemolyze. A drop of blood will be placed in 1.8% urea. The cells will rapidly hemolyze because urea is an isoosmotic solution. Isoosmotic means a solution with the same osmotic pressure as an isotonic solution, but lysis occurs because solute particles, like urea, diffuse rapidly into the cells. This diagram shows a normal red blood cell in the upper left-hand corner. Water is coming in at the same rate it is going out. This is in 0.85% sodium chloride. 1.8% urea is added. The urea diffuses into the cell at a greater rate than it is coming out. It diffuses very rapidly because urea is a non-effective osmotic particle. Therefore, water also diffuses at a very rapid rate, and the cell becomes swollen, misshapen, and eventually hemolysis will occur. Blood will now be added to these three solutions. To 2.5% glycerol, to 2% lidocaine, and last to 7% lidocaine. These tubes will be vortexed and centrifuged after we wait 5 minutes. Hemolysis of the red blood cells occurs because glycerol and lidocaine in water have a low partition coefficient and they diffuse slowly through the cell membrane. Water will follow and eventually the red blood cells will hemolyze. Glycerol and lidocaine are non-effective osmotic solute particles. These are 2 carpules of xylocaine hydrochloride from the dental clinic. I'm going to add a drop of blood to this carpule. And I'm going to mix the carpule by inversion. Blood has already been added to this carpule, and we've already centrifuged it. No hemolysis has occurred in these carpules, even though lidocaine hydrochloride is a non-effective solute particle. The drug manufacturer has added 0.6% sodium chloride to these carpules to avoid tissue damage due to differences in osmotic pressure. These carpules have two non-effective osmotic solute particles, lidocaine hydrochloride and 1 to 100,000 epinephrine have been added. These two solute particles readily diffuse through a cell membrane. This film clip was made by Dr. Merrill Wheatcroft in the Department of Pathology. It will illustrate the effects of osmotic pressure on cell morphology. Polymorphonuclear neutrophils were placed into saliva. Saliva is a hypotonic solution. As water diffuses into the cell, due to the difference in osmotic pressure, the cell will lysis In the left-hand corner of your screen, you can see lysis of this neutrophil as the granules in the neutrophil stream from the cell, indicating disruption of the membrane. In the oral cavity, neutrophils migrate from the gingival tissue into the gingival sulcus, which provides an isotonic environment. There they can maintain their integrity and function, but as they move out into the hypotonic saliva, they swell and burst. Thus, neutrophils are not functional in the saliva. This difference in osmotic pressure between saliva and cells is demonstrated in this cell as it swells and lyses. The leukocyte actually collapses as it loses its cytoplasm, leaving only the nucleus. 5% of your grade in CT6 will include questions directly from this videotape.